Hey everyone, Paul from Ortho Eval. Today I want to talk about an ankle sprain, how to do an evaluation, when do we send people for x-rays or not, and where do we go from here. So this young lady is 46 years old and a week ago rolled her ankle. Typical inversion ankle sprain, felt a very large crack, pop type feeling. She's able to weight bear on it. But having a hard time with stairs, especially going downstairs where the ankle has to dorsiflex and she has to put that weight through it, obviously bothers her quite a bit. She developed some swelling around the lateral malleolar region and some bruising, as you can see, down into the toes. Now, it's not uncommon to get some bruising down here, although she hasn't had any injury to these toes. It just pools in that area, okay? So when I first start with her, I asked her all the questions, about, if she's osteoporotic and has issues like that, any underlying medical condition that we should be concerned with. I start off with, a Homan's test to make sure she doesn't have a DVT. I then follow the fibula from proximal to distal because some people can develop a Mazenou's fracture or proximal fibular fracture. When the ankle rolls, there's a twist that happens and you can actually fracture that fibula up here, and that gets missed because x-rays are done down here. And so I palpate that fibula, no problem there, correct? Doing okay? All right, and then as I get down, if we look into the Ottawa ankle rules, the posterior distal 6 centimeters, okay, we look to see if she has any pain or on the tip, okay, and we're getting some wincing and some noises in the background, so she's very, very tender right in this area here, okay. She is not tender on the posterior aspect or distal medial malleolus. Now, as far as Ottawa foot rules, proximal base of the 5th metatarsal, if that's tender, we should be looking at x-raying the foot also. And she's going to jump off the table here. You can't see her, but I told her I'd keep her face out of this. So very, very tender there. And then the other spot would be the navicular, and she has no tenderness there. Okay, so we have proximal 5th, and we also have the distal tip of the fibula. The other thing I'm looking for, I'm doing an anterior drawer test, and it's going to be hard to do and for you to see it, but I'm going to hold like this, and I'm going to just give a nice anterior draw, and there's a nice stable endpoint. It's not very loose, it's not sloppy. Okay, talar tilt test. I want you to relax your foot and ankle, and I'm going to tilt a little bit. She has some pain with that, okay, but there's a nice little endpoint and it doesn't feel unstable over here, and you would really feel that roll in if that was positive. And then when I plantar flex her and invert her, it really causes a lot of ATF ligament pain, okay. If I go posteriorly, not too bad. CF ligament, not terrible. And it really gets to be a lot worse right here in that ATF. And I'm not going to poke too hard, and a lot of swelling there. She also has some tenderness in the shaft of the 4th metatarsal. That's one of the most painful spots for her. Another reason why I think she should have an x-ray. So she's going to have that done. If that comes back negative, we're going to start her right up with some therapy. We're going to start by trying to get rid of some of this swelling. I'm big on compression therapy, so either a compression sock. I like to do a walker boot right away because of the cam effect, and then it stabilizes the ankle so it doesn't rock back and forth, and it gives it a chance to rest. And I usually like a walker boot that has some sort of an air bladder in it so we can compress it and get rid of that swelling at the same time. Weight bearing is very important, so I'd like to get her weight bearing right off. And so we're going to protect this. We're going to send her for some x-rays. If those come back negative, then we're going to start her on some gentle motion, avoid straining the ATF, and start to work on some gentle proprioception, gentle range of motion. Dorsiflexion is actually pretty good. Go ahead and pull your foot up toward you, and the ankle mortise locks in a good position there, so we want to encourage that. So if you have any questions in regards to this evaluation or anything else that you might like me to do a video about, please leave a message in the bottom of this video. I'd be more than happy to get to you, or contact me at paul@orthoevalpal.com, and make sure you check out our new website at orthoevalpal.com. Take care.